All right, everybody, we're back. Welcome to Module 2 of our Triage to Alternate Destination training program for today. This program is going to be, or this module is going to be focused on understanding mental illness. So giving you all a broad overview of what mental illness is, and just increasing everybody's understanding. Okay. So our learning objectives for this module, first off, is defining mental illness, looking at mental illness as a continuum, looking at the common types of mental illness, signs and symptoms and diagnosis of each of those. Also looking at the causes of mental illness and some risk factors. Looking at the stigma that is invariably associated with mental illness and mental crisis. Looking at the impact of mental illness on our patient population, and then talking about some of the prevention and early intervention pathways that exist for patients. And then lastly, looking at some of the community resources that are out there that not only affect your patients on a day-to-day basis, but kind of empower you to be able to direct folks to some of the help that they can get out in the community.
Mental illness. So it is a wide range, and there are lots of diagnoses under this umbrella called mental illness, and we're going to go through some of those specifically, but it can be thought disorders, it can be behavioral disorders, and sometimes these are linked together also to substance abuse.
Absolutely.
As well. And so not every individual with mental illness has a substance use disorder, and not everyone with a substance use disorder has a mental illness, but you'll often see these in the patients you encounter in the pre-hospital environment together.
Absolutely.
And in a broad brush, mental illness does have significant effects on a person's ability to process and to really function in a daily way, to function from eating, from working, from all kinds of things. And it can affect all aspects of your life. It can affect your social life, your family life, your work life, and it can really have a significant impact on your just ability to function from day to day.
Absolutely.
So it's complex, multifaceted, but there's lots of causes. Lots of causes. It's genetic, so you see a lot of this run through families. Some of it is by experience. We're going to get into some of that, just some life experiences. And some of it is, like I said, linked to substance use.
Absolutely. So, and one of the things that it's important for all of us to understand about mental illness is that it is a continuum. So on the one side, you've got folks who just, we all know these people, the people that they've got their life together, they look like superstars.
Everything's great.
Everything's wonderful, right? So you can say that these are the folks that would have optimal mental health. So these are people that have great emotional well-being, they've got positive relationships, they've got coping strategies for when the stresses of life get to be too much, where they're able to go exercise and do other things that allow them to cope with those stressors. But then on the other side, you've got folks that have severe mental illness, and like Kevin, like you talked about, folks who whether they have a substance use disorder, or they've got risk factors, or they've got other environmental influences or histories of traumatic illness or traumatic events, which can put you into a real place of having a severe mental illness. And these, as you also said, Kevin, is that these are the folks that have debilitating symptoms. So it's hard to get out of bed in the morning. It is hard to pay your bills. It's hard to have positive relationships with folks in your family. And that's where you really start to see that these people are kind of regress, break down, and can really get into trouble. But then it's great for us as clinicians to understand that there's a continuum. So we've talked about both sides of the pathway here, but in the middle lies most of us on a day-to-day basis. So, there are going to be days when you don't feel well, and you've kind of had a stress. Maybe you had a bad patient interaction or something that's caused you to feel a little bit down. That doesn't mean that you're on the the pathway to severe mental illness, but it certainly kind of puts you on that continuum, and all of our ability to have positive relationships and cope with stress kind of helps us move on that continuum back and forth. So the common types of mental illness that we're going to talk about today, so you've got your mood disorders. So these are conditions like depression or bipolar disorder that can affect your emotional state. You've got anxiety disorders such as generalized anxiety disorder or panic disorders or social anxieties, which can cause really intense or excessive worry or fear. Psychotic disorders, which we encounter a lot in the pre-hospital world and in the emergency department. These are conditions like schizophrenia, which really involve distortions of your thought and awareness. Mm-hmm. So, and they're often our schizophrenic patients are exhibiting features which suggest that they're hallucinating or having delusions in their daily life. You've got eating disorders, so conditions like anorexia or bulimia, binge eating disorders, which involve extreme emotions that are often surrounded by a patient's weight, also their relationship with food and body image. You have personality disorders, so things like borderline personality or narcissistic personality disorders, which can really feature unhealthy patterns of thinking and behavior, which can get people engaging with 911 just simply based on a personality disorder. And then also you've got neurodevelopmental disorders, so these are conditions like autism spectrum disorder or ADHD, your attention deficits, which can really change the way that people behave and can cause people to be on that continuum of mental illness and cause them to engage with 911.
So there are several symptoms of individuals with mental illness, and I'm sure as you're watching this, some patients that you've taken care of are just coming to mind right away. You can maybe think of the person you saw, maybe even on your last shift that you were on. But these individuals present with a whole wide variety and host of responses to their mental illness. There can be emotional changes where they're sad, crying uncontrollably, even sometimes laughter is some people deal with their stress with laughter, and then just severe mood changes, just severe deep depression. But it even gets into the cognitive realm where there's confusion. We typically see this a lot in our older population, where their mental illness just may present as just severe confusion and changing, like for example, someone who's changed their environment where they live because their spouse has passed away and now they're living with their family and it's changed their behavior, and they end up coming to the emergency department or calling 911 because, why is mom confused? Why is dad confused? And then this can also trigger behavioral changes as well, from everything from complete withdrawal all the way out to just striking out and violence. It can cause folks to do things that they wouldn't normally do, like use a substance because they find some sort of comfort in using that substance or unhealthy eating patterns. And then, everything from extreme weight loss from not eating, and also just pain that is just hard to and explain.
Yeah, and I think that's a big one, Kevin, is that those folks that have chronic pain and that pain becomes very hard to manage. I think that's an area that we don't explore too much as clinicians in the emergency department, but certainly is that a trigger for somebody's chronic pain?
Absolutely. And so when you have this spectrum of mental illnesses that have a wide variety from mood disorders to personality disorders, and you have these behavior changes, like how do you tease all that apart? Like, how do you get to a diagnosis? And oftentimes this is through a long process. It's through clinical interviews. It's sitting down and teasing out what it is that actually triggered this event. There's also psychiatric evaluations that are done by professionals through psychiatrists, psychologists, social workers, clinicians. you, just sitting in the back of an ambulance and talking through, like how did we get here? Where did this come from, and why are we here? You can sometimes tease some of that out. Some of it involves some medical tests as well. Lab tests looking to see if there's anything wrong with the chemistries, renal disease.
Thyroid disorders, things like that.
Yeah, thyroid disorders. But I do want to point out that I think that at least with our program in Stanislaus, the one thing that we discovered in the American College of Emergency Physicians that has a position statement out about this, that the vast majority of individuals with an isolated mental health disorder, the vast majority actually have normal labs and don't require a lot of testing. And that's really important to talk about with the transport to alternate destinations, because we could get asked questions. It's like, well, what, don't they need a bunch of labs like when they come to the emergency department? Don't we order this battery of labs? And to be honest with you, we do, but none of it is really backed by evidence. Right. Very, very rarely. You'll find something every now and then. You'll find a urinary tract infection that's caused a behavioral change, the thyroid disorder. Those are really rare. Those are the exceptions.
Super rare, super rare. And we do all of this work which drives the time that patients are in the emergency department unnecessarily. It drives up cost. It makes patient satisfaction worse. Yeah. So your point is spot on, Kevin, in that the vast majority of folks that present in mental health crisis do not have a medical concern. The vast majority of folks that present in mental health crisis do not have a medical concern.
Correct, which is what makes the TAD program completely safe. And it's not like we're taking them to a facility that's just going to put the blinders on and completely ignore. If a patient's condition changes for some reason, they know to engage a different level of healthcare, and they will do that. But fortunately, I can just talk about the Stanislaus program again because I have the most experience on it. 2,000 patients consecutively followed. Not a single one of them fell out because of an unidentified medical issue. Not one of them.
And that's great to know, and great to know that it's safe. So some of the causes of mental illness. So we touched on this earlier, is that there can be genetic factors. So if you have a family member that has a mental illness that puts you certainly at risk, we know that mental illness can follow and run in families. There are biological factors. So just changes in brain chemistry, brain structure, or medical conditions like infections. You know, we all have examples in our mind about that patient that has had a traumatic brain injury earlier in their life that can really change the way that they change their mood. It can change the way that they perceive their environment, and it can cause mental crisis. Also environmental factors, so exposures to toxins, drugs, and alcohol being, again, we talked about this at length, that concurrent substance use disorder is very common in our society and can lead people down the road towards mental illness. And also prior traumas or stress, so life experiences such as abuse, severe stress, or significant loss, so the death of a family member, can certainly be a triggering event to put somebody into mental health crisis. Some of the risk factors, again, we kind of moving from causes into more risk factors. So again, that we talked about family history, the life experience, and the substance use, and also some of the social factors that can exist that can put people into crisis as well. So isolation. So if you folks who have moved to a new city and don't have that support system in place, if you've got a lack of support, or if you're in a stressful living environment, so people who are homeless, unsheltered. We have a large community in Sacramento County of these folks, and that alone can be a trigger to cause people to move into some mental illness issues. Okay, so we're going to be talking now about mental illness and the stigma that can come along with that. So stigma is one of the largest barriers that patients face when it comes to getting treatment and support for mental illness. So the discrimination that can come when somebody has a mental illness, some of the isolation that can come from that same discrimination, and really the shame that people can experience to really hold them back from coming forward and seeking treatment or care. And a lot of times what will manifest is that folks have been in crisis for a long, long time, days, weeks, months, even years, and then they reach a point where they just don't have the supports anymore, and they're in crisis and they're calling 911. So stigma is important for us all in our society to understand how it impacts folks in their mental well-being. So there are different types of stigma. So the first one is our public stigma. So negative attitudes that just exist in general, and the beliefs that we have as a society about mental illness.
People talk.
Absolutely.
Right. And that's part of it, right? They've all been involved in conversations maybe outside of this. It's like going, did you know that so-and-so is? And then they understand that now they're part of that, and I don't want anyone to know this.
Right. So they hold back and they don't step forward and say, I'm in crisis, I need help. And it leads you down that path, like we talked about in our continuum, that you're all of a sudden getting more towards the severe mental illness kind of part of that continuum. The other one is self-stigma. So really internalization of the public stigma, which leads you to feel that sense of shame or low self-esteem, which can put people on a path to not being well. And then the other thing is institutional stigma. So policies or practices within all of our organizations, which might not be meant to be harmful to folks, but can be putting people at risk. And all of us as leaders in our own organizations need to be aware about how those policies can affect people.
Yeah, I mean, you think about what do you do and how do you process the emotions of a pediatric drowning?
Right.
Right. So this can trigger somebody who was totally unexpecting it, and now they're dealing with this crisis. And do you know what to do in your organization, who to reach out to, how to get help? Those are really important conversations, and hopefully the leaders that are watching this of those institutions will engage with their employees and explain, hey, if you need help, this is how you get help.
Right, or if there are no pathways, then just to be able to feel empowered to step forward and to talk to your leadership and say, hey, when we have those critical incidents, so pediatric drowning, pediatric CPR that's coming in the emergency department, we need to be able to put our arms around the people that have worked in those events and to make sure that they're getting the help that they need.
Yeah.
So there are consequences for stigma. So the folks that are experiencing those, that whether it's organizational or societal stigma, and not wanting to come forward, they have a reluctance to seek the help that they need. So out of a fear of judgment. There's also social isolation that can come. So, feeling ostracized from family or friends, or, that instance where, hey, maybe that person can't take care of themselves. They're not tough enough. And it can really kind of isolate them and put them out in a position where they feel like they can't reach out for help.
We're the rescuers. We're not the ones who need the help.
Well,
right.
And that puts us at risk.
It puts us at risk. Just that very attitude. It's like going, wait, no, I'm the one who helps people when they're in trouble. I'm not the one who needs the help.
Right.
And that whole attitude just kind of creates some challenges.
Absolutely. And then there's reduced opportunity. So feeling that if you were to come forward because you're having a mental crisis or you're kind of sliding down that continuum, that you might have reduced opportunity for employment, or that you might have a reduced opportunity to go on that educational opportunity, or in some cases, just that stigma can impact people's ability to just care for themselves. So all of a sudden, are there housing opportunities that can be blocked? And then the stigma can also lead to worsening symptoms. So obviously the stress or the shame of having a mental illness can lead to just a snowball effect of that mental illness into a worse state. So combating stigma. So how do we stop the things that we just talked about? So whether it's organizational or societal stigmas. First off is education and awareness. So increasing public understanding about mental illness, dispelling some of the myths that can lead to some prejudice that exists out in our communities. Sharing personal stories. So we've all had experiences where in the emergency department we take care of some really, really sick people, and some sad cases where you don't get the outcome that you want. And to be able to share those experiences and to humanize that experience, and to reach out to that person that may be having something similar that you've gone through, can really lift people up and to help them kind of move back on that mental illness continuum back into more of a state of well-being. Also supportive language. So using respectful and accurate language when it can be helpful in reducing stigma. So not, that whispering event or like pointing across the room, hey, that person's crazy because they had this event happen. Reducing some of that, and just making sure that you're approaching everybody in a respectful way is important.
Right.
Yeah. And the other thing is goes in hand with what we just talked about is advocacy. So we are all advocates to make sure that all the things that we've talked about are mitigated. So making sure that there's policies and practices in place that promote emotional well-being, and then advocating for that patient. So, and I think triage to alternate destination is a means to advocate for that patient. So, I'm going to evaluate you, and I'm going to get you the help that you need, and I'm not just going to reflexively take you to a place that a lot of people will almost think it's like going to jail. If you I don't want to go to an emergency department. I would like to go someplace better. And if you fit within the fence and boundaries of a triage to alternate destination program, that's a way for you to advocate for that patient and get them the help they need.
Absolutely. So, what are the impacts of mental illness? We've talked about a lot of them, but some of it, if you think about it, it's just reviewing again, just daily functioning. Can I get out of bed? Am I sleeping at night? Mm-hmm. Sometimes I lay awake all night and you just can't turn your brain off.
Right.
So it affects your sleep cycles, it affects your food choices and how you eat, and all of this feeds into your ability to go to school. Some of you watching this may be in school. It's like I can't study for that test, mm-hmm. or it just feeds into making just daily normal activities super challenging, and that spills over into stress in your relationships with your significant others, with your kids, with your mom, your dad, your coworkers. Just that these relationships just become super strained. And then we've talked about pain and worsening of chronic issues. I know a lot of folks get help with their own, and I'm one of these folks that just kind of helps just kind of clear your mind with exercise. Mm-hmm. But the physical exercise starts to fall off, but it can even worsen chronic problems, because if you're a diabetic, it can lead to higher blood sugars. If you have high blood pressure, you can worsen your high blood pressure. Mm-hmm. So it starts to uncover all of these things. And all of this feeds into just this loss of quality of life.
That's right.
Yeah. So it also has broad societal impacts as well, not just with the individual or with their closest friends, but it also impacts the broader community as well, which there's loss of productivity, people not going to work, people calling in sick, which eventually ends up costing a lot of money, not only to them personally, but also to the organizations and the folks that are relying on them, as well as it increases demand in healthcare, hopefully more visits, right? Mm-hmm. That they're seeking care, but a lot of times these individuals will wait and get really sick, and then getting them out of that valley is just a much bigger climb and takes a lot longer, which puts a lot more stress on just the whole system in place. We've talked about absenteeism at work and reduced work productivity. Mm-hmm. Even if you're at work, you're not really working because your brain is just going. And then also just some greater needs for things like housing, especially in our unsheltered community, mm-hmm. Who suffer a lot with mental illness and with substance use disorder, that it puts strain on housing and community programs that are trying to support these individuals.
And I think we saw a lot of this coming out of the COVID pandemic, when people, delayed medical care. There was a lot of isolation. There was a lot of worsening of mental mental illness, and a lot of people came out of that in crisis, and that was a driver behind a lot of the engagement with 911 and people calling to go to an emergency department because they just didn't know how to get the care that they needed or how to move forward.
Yeah, absolutely. So there's several ways that we can either prevent or have early intervention, and the most important thing is I think having an understanding of where to get help and having an understanding of when you're in crisis, you're going into crisis. So all of these things feed into a person accessing care earlier, because you could argue that if you access the care earlier, you have fewer physical and health effects. You don't get into the valley as deep as you normally would get, and so you can get out of it easier. And also having some of the things that also help individuals to kind of prevent the mental illness, what we've already talked about, is having a support structure around you, having that person or those people that you can confide in. And I know at least at our work, we have a program called Doc Rise, and it's a group of docs that we work with that are there and put themselves out there that says, hey, when you need help, we're here for you, reaching out. And employers have EAP programs. So knowing how to access that, promoting healthy lifestyles too. I mentioned a little while ago that I work out. Like there's nothing that gets me through a rough day better than having to go do a bunch of weightlifting and a bunch of running and get my heart rate up. But that's me. That's just my thing. But I think the counter side of that is if I were one of those people that says, wow, I had a rough day, I'm going to go home and have 6 beers tonight instead of just 1 or none, right? I think that's counterproductive. That's not going to build a healthy environment.
Absolutely. So, and some of the other early intervention techniques that have been employed to successfully kind of off-ramp people off of the continuum slide. I keep coming back to the continuum, but I think it's important. It highlights how it's super important for us to be aware of is our screening and assessment. So regular mental health checkups that patients can have with their primary care providers. Again, as we moved through COVID and kind of in the months and years after the pandemic ended, is that people are really trying to catch back up and to re-engage with their primary care doctor, get themselves back into a place where they have coping skills and other things. Access to services. So timely access can prevent worsening of underlying mental illness. So triage to alternate destination. This gives you guys who are going to be employing the policies and protocols for the county to get people the help they need. So putting them in contact with a clinician. So like I'm an emergency physician. I love it when you guys bring patients to me, but I'm not the guy that's going to be best for that person in a mental health crisis. I'm going to make sure that they don't have a medical problem which is causing their issue, but ultimately I'm not the right resource for that person in that right time.
Yeah, and we have some skilled clinicians in our emergency departments and in your emergency departments, if you're not from Sacramento, that are built to do this. But I think it's not a stretch to understand that this could potentially delay their care. So if a person eventually does, if they are sick enough they need to go to a facility to get more in-depth care, that an emergency department hallway is probably not the ideal place.
Absolutely. So other interventions, we've got public awareness campaigns, 988 in the state. So a suicide prevention hotline that people can engage with. Those are great public awareness tools that are starting to emerge. We've got integrated care, so our primary care providers kind of meshing with our mental health clinicians to get people the help that they need and easier referral pathways for people, and then supportive environments. So within our schools, our workplaces, and the community at large, just to have more of a supportive atmosphere around mental illness. So there's also some other community resources I want to make sure that everybody's aware of. So we have the National Alliance on Mental Illness, which provides resources, support, and advocacy for individuals and families for if there are family members or individuals, like I said, that are experiencing mental illness. We've got the California Department of Healthcare Services, which can also provide health support through county mental health departments. So here in Sacramento County, we have a robust behavioral health department, which is able to provide help for folks. Your Mental Health Services Act. So this act funds a wide range of mental health resources across the state of California. I mentioned 988, our suicide and crisis lifeline, which is a national program which is available for anybody who is finds themselves in need. Then we have our local mental health departments, again through behavioral health here in Sacramento County, that can also help and provide resources for people in crisis.
That takes us to the end of Module 2, huh?
End of Module 2, and we'll see you for Module 3.